party people, let's do some physical therapy. The issue I'm dealing with is a meniscus tear and ACL strain, and part of what that's causing for me is my knee is staying bent all the time. I can't fully extend it in the same way that I can extend my other leg. So that's the main thing that we're working on. In addition, we're also strengthening those quads, and in my case, actually trying to get the calf, sorry, I was gonna say gastroc, get very technical on you, to release, because part of what's happening is your other muscles want to protect your knee, like these cats want to protect me. So because there's an injury, your other muscles tighten up. They're basically trying to come in around it. And so part of what we need to do is to get them to let go and loosen up. One thing you can do, a towel, or I happen to have this, anything soft. So I tried using a yoga block, that hurts. You want something softer. And you're putting it right under your knee joint and then contracting your quad and pressing down into it. So that's especially if you've noticed you're not getting enough flexion up here. That's gonna help get some strength back. The other couple that I like there, so when you're back, thinking about pushing your heel along the floor so your toes are flexed and then pulling it back. And part of what you're doing here is you're watching that you're keeping your knee and your toes aligned. So a lot of times we're gonna start with that knee moving in or out because it's trying to compensate elsewhere. So again, that's gonna get your quads going. Same idea, laying back and lifting just to 45, so just till it meets that other knee. And you're just kind of getting some of that strength back that we lose when there's an injury. Now, the other thing I mentioned was getting some things to release and let go. So there's two ways you can do this. Any kind of ball, I happen to just have one for my shoulder here handy, so I grabbed it. You can place it in between your thigh and your calf and kind of work that leg back and forth. When you find that spot, and you know, just hold. You can hold for like 30 seconds. And then to make it a little more, once you get that 30 seconds and you let go, start to point and flex your foot. Whole different story. This is so different than using the foam roller. And remember, the goal here is that we want this muscle to relax. So when I hit that spot and it hurts, I have to in my head be telling myself to relax. You can do this on the floor. I find that to get enough pressure, you may have to like cross your legs over though. So for me, that sort of pulling motion is where I'm actually getting in the deepest and getting the release to happen. All right, my knee is more important than my head for this one, so I might be a little cut off, but you can hear me. Find a door. You want to put the ends of your band in it. Leg back. Come back till there's a little bit of tension. And then you bend, straighten, so you engage the quad, not your glute, and then pick the other leg up and hold. Put it down, bend, straighten, hold. You're going to engage your core. You're not going to have a choice. It's going to start to tire out your quads. Same band, lower down. Yes, I'm probably gonna disappear from the frame, but again, the leg is what matters. So the idea of what we're going to do here is create some space in the joint. So you're gonna place your heel in, and then the easiest thing to do is sort of cross it over the top of your foot, and you're just going to scoot back until you feel tension, and then you're going to let your leg totally relax and allow it to stretch. For me, that means it's going to be kind of helping it to get into that full extension that I'm currently missing. Hold it for like 90 seconds. There you have it. That's a lot of the PT that I am doing for now. I will do most of those things a couple times a day, every day, because I want to get back out there running and running strong.